Welcome to the EAU podcasts. In this episode, UROONCO bladder cancer chief editor Dr. Benjamin Pradere talks to Dr. Nadine Houede on the results of iNDUCT trial.
Dear friends, dear colleagues, it's my pleasure today to have Professor Nadine Houede from France, who presented today the iNDUCT trial at ASCO GU 2025 in San Francisco. Dr. Houede, thank you very much for being with us today. It's also a pleasure for me because it's a French design trial on upper tract urothelial carcinoma. Can you tell us a bit about this study, the rationale behind, and how came the story of the iNDUCT trial?
And the trial, it's first a collaboration between urologists and oncologists. We are very strong together with the Alliance team in France, and we were able to design this specific study for upper tract urothelial carcinoma. It's a rare disease, so it's very important to have specific clinical trial design for them. We raised the question of neoadjuvant combination with immunotherapy and chemotherapy, which was not done before, knowing that it's important to use cisplatin-based treatment for this patient. And the patient in neoadjuvant setting, they have better renal function. So that's very important. So patients were enrolled, 50 patients over 3 years, 10 centers in France. And 30 patients were able to receive cisplatin-based treatment with durvalumab. And 19 patients received carboplatin-based treatment with durvalumab. So first, it's a very safe treatment, so it was very important because we didn't have negative impact on the surgery. Usually patients have hematological side effects related to chemotherapy. We have only few minor immune-related side effects, so very safe profile. And after that, we have a very good downstaging. Even if we don't met our primary endpoint, which was a PT0 rate. We have 60% of patients and more who have downstaging, and we were in a good situation to go through RNU.
Yes, you had a YPT0 around 13%.
Yeah,
but overall in response, you had more than
61.
61.
Yeah, we had 13% PT0 for the cisplatin-based treatment. It was more disappointing with carboplatin, but we all know that carboplatin does lower response with it. But in total, we have 61% of patients which have done staging. And in total, in our population, we have only 3 patients who were N plus at the time of the surgery.
Yeah, and you also raised during the presentation all the difficulties to get the pathological examination upfront before the surgery. How did you proceed, and how do you see the next step for this management?
Yeah, in our study, it was a pragmatic study. We would like to raise the question, are we able to do this trial for this rare population? So we did it, but 50% of our patients went through biopsy or had positive cytology. So it's very difficult to have a good histological staging before any treatment, which is a big point for this population.
Thank you very much. And so basically we see that it's a feasible trial, and I have to say congratulations, because this is one of the first phase 2 trial where we see this design in upper tract urothelial carcinoma, and I think it was a huge effort from the French community to get this patient enrolled. How do you see, now that we see that there is a benefit, a trend to a benefit for response, how do you see the next steps after this iNDUCT trial?
Yeah, we have the opportunity to go further with a phase 3 clinical trial. We obtained a French grant, and a lot of clinicians now will work with us because we will be 43 teams to be able to enroll patients in the phase 3 clinical trial. We call that iNDUCT 3. And we have comparison with a randomization between chemotherapy alone in neoadjuvant setting versus chemotherapy plus immunotherapy. And at this point, we hope that we will be able to change the treatment of our patient and to improve their prognosis.
Thank you very much, Nadine. I think it's also very important to see that we finally get more high quality of data regarding neoadjuvant treatment. And we know that it's still hard to convince physicians to give neoadjuvant treatment in upper tract. So I believe that the future is bright for upper tract thanks to your trial. And I thank you very much for your time.
Thank you so much.
Thank you for listening to this episode of EAU Podcasts. To keep up to date with bladder cancer developments, visit our educational platform UROONCO Bladder Cancer. For more EAU podcasts, please go to your podcast app and subscribe to our EAU podcast channel for regular updates.